Your vet just handed you blood test results for your dog that look like hieroglyphics. Numbers, abbreviations, red flags everywhere. In the next 6 minutes, I'll decode what those blood panel results actually mean, which numbers matter most, and when those red flags are actually concerning versus when they're not. All information is sourced from VCA Animal Hospitals, PetMD, and the American Animal Hospital Association. Let's break it down. Getting your dog's blood test results can feel overwhelming. You see values flagged as high or low and immediately worry something is seriously wrong. Here's what we'll cover: what a CBC actually measures, understanding red blood cells and anemia, white blood cells and your dog's immune system, chemistry panels for organ function, and what normal range really means. Before we start, this is educational content to help you understand your vet's explanations. It's not medical advice. Never diagnose or treat based solely on blood work. Always have your vet interpret results. Let's start with what a CBC is. CBC stands for complete blood count. It measures 3 cell types in your dog's blood: red blood cells that carry oxygen, white blood cells that fight infection, and platelets that help blood clot. Think of it as a health snapshot. The CBC can detect anemia, infections, immune problems, and bone marrow issues before your dog shows obvious symptoms. Here's what's important. Your vet doesn't just look at counts. They also examine how the cells appear under a microscope. A low count might seem alarming, but if the cells look healthy and bone marrow is actively producing new ones, that's actually a positive sign. Let's talk about red blood cells. These are the oxygen carriers. Your results will show several values: RBC count, which is how many red cells are present; hematocrit, which is what percentage of blood is red cells; hemoglobin, the protein that actually carries oxygen; and reticulocytes, which are young red blood cells. Low counts equal anemia. But here's the key: your vet needs to figure out why. Is it blood loss, destruction of red cells, or production problems? Mild elevations often just mean dehydration or excitement, usually temporary and not alarming. Cell size matters too. Large red cells might indicate vitamin deficiency. Small cells might suggest iron deficiency. And here's a reassuring sign to know: if you see the term polychromatophilic cells, those are bluish-tinged young cells. That means bone marrow is working properly to replace red cells. Now, white blood cells, your dog's defense system. There are 5 types measured. Neutrophils are most common and fight bacteria. Lymphocytes fight viruses and produce antibodies. Monocytes clean up dead tissue. Eosinophils respond to allergies and parasites. And basophils are least common, involved in allergic reactions. Here's what the numbers tell you. Normal to high counts mean good news: your dog can fight infection. Extremely high or low counts suggest severe infection or bone marrow disease. If you see lots of immature cells, called bands, that means bone marrow is working overtime to fight infection. Important distinction: a high white cell count isn't always bad. It often means the immune system is doing its job and mounting a strong response. Let's move to the chemistry panel. This checks organ function. For liver, you'll see ALT, ALP, and AST. ALT is a liver leakage enzyme. When elevated, liver cells have been injured. ALP is found in bile ducts and can indicate liver, gallbladder, or even bone issues. AST also comes from liver, but muscles produce it too, so your vet needs to determine the source. For kidney function, 2 key markers: BUN, which stands for blood urea nitrogen. It's a waste product filtered by kidneys. High levels suggest kidneys aren't filtering properly, or your dog is dehydrated. Creatinine is a more specific kidney marker. High levels indicate reduced kidney function. Glucose measures blood sugar. High glucose might indicate diabetes or stress. Low glucose is less common but could signal pancreatic tumor or severe infection. So, why all this matters? These tests catch kidney and liver problems early, often before your dog shows any symptoms. That's why annual blood work for senior dogs is so valuable. Now, let's talk about what normal range really means. Reference ranges are established for the average healthy dog. But here's the catch: breed matters. Greyhounds have different normal values than German Shepherds. Age matters. Puppy values differ from senior values. And individual variation exists. Some perfectly healthy dogs run slightly high or low their entire lives. When should you actually be concerned? Values significantly outside the range, not just barely. Multiple abnormal values together, suggesting a systemic issue. Trending worse over time when comparing to previous tests. Or abnormal values that match your dog's symptoms. When not to panic. A single, mildly abnormal value with no symptoms. Values that improve on retest after hydration or stress reduction. Or known breed-specific variations. Critical rule: always interpret results with your vet. They know your dog's full health picture. A flag on the printout doesn't automatically mean crisis. Common mistakes pet owners make. Mistake 1. A red flag means my dog is seriously ill. Not necessarily. Flags just mean outside normal range. Could be minor dehydration, stress, breed variation, or yes, something to investigate. Context matters. Mistake 2. All numbers are normal, so my dog is perfectly healthy. Blood work is one tool. Some conditions don't show on standard panels. Physical exam and symptoms matter too. Mistake 3. High white blood cells mean the infection is getting worse. Often the opposite. It means the immune system is mounting a strong response, which is good. Very high or very low is concerning, but moderate elevation shows the body is fighting effectively. Traction. Mistake 4. I can interpret results myself by Googling. Individual values mean little without context. Your vet interprets all values together, considers breed, age, symptoms, and may need additional tests. Recap. A CBC measures red cells, white cells, and platelets. Red cell counts tell you about anemia and oxygen transport. White cells show immune system function. Chemistry panels check liver, kidneys, and glucose. Normal ranges vary by breed and age, and flags don't always mean emergency. You now understand what your vet is looking at when they review blood work. More importantly, you know what questions to ask. If this helped you make sense of your dog's blood test results, give it a thumbs up. Drop a comment with your biggest blood work question. I read everyone. Thanks for watching, and remember, when in doubt, call your vet.